pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanuatu on Facebook and YouTube every Saturday at 4 p.m. on the Online Pregnancy School as she discusses pregnancy, delivery, and childcare.
Hello, ladies and gentlemen. Welcome to this wonderful program, your very own program, the Online Pregnancy School. You know, life is such that we need knowledge, because when you have knowledge, you can go very far. If you are doing something and you don't have any knowledge about it, you cannot do it very well. And that is why we bring you the Online Pregnancy School. This is not just for pregnant women, but for everyone who wants to know about pregnancy and childcare. So stay with us. Let's take a break. Welcome back. This program is proudly sponsored by Promise Ghana, Vanuatu International, Reverse Tap, Samsara Ventures, and Erama Clinic. We have spoken so much about these sponsors. They have been helping us to bring you the Online Pregnancy School. So I will kindly ask you to visit them. You will see their numbers on the screen as we go along. So please do business with them, and we'll be very happy you did. Over the past months, we have been talking about pregnancy and what a pregnant woman should do. In fact, we have even spoken about infertility and how people can be supported to become pregnant. Today, we have another aspect of pregnancy, and we are going to talk about medication or medicine use during pregnancy. Is it okay for a pregnant woman to take any medicine at all? If not, why not? And if yes, when should she take it? And what should she do if something goes wrong when she takes a medication? That is what we are going to talk about today. And today, my guest is a practicing pharmacist in the UK. We have gone international. Her name is Mrs. Lydia Annan. Mrs. Lydia Annan is a pharmacist who has gone further to train to prescribe. So she's in the right position to talk to us about medication use in pregnancy. Auntie Lydia, you are welcome.
Doctor, thank you so much. And
How
thanks
are
for
you?
having me on the program.
How
I'm
are
good,
you
thank you
doing?
very much.
We thank God. Today we are going to talk about medication use in pregnancy. But before we do that, who is a pharmacist? I said that you are a practicing pharmacist, which means that you've trained as a pharmacist. So who is a pharmacist?
So a pharmacist, also known as a chemist or a druggist in some countries, is a healthcare professional who specializes in the use of drugs. They have knowledge of how drugs work in the body. And with this knowledge, they are able to provide advice on the proper and effective use of drugs.
Wow. And that is why they work very closely with the other prescribers, like the doctors and other people who prescribe. Thank you very much. You said that a drug or medicine, but what is a drug or medicine?
So a medicine is a preparation that can be used for the treatment, prevention, and management of a medical condition. Okay. When we talk of treatment is you taking a medication to get rid of a medical condition. For instance, if you have a headache, you can take paracetamol and your headache will go away.
Okay.
When we talk of prevention, you take medicines to prevent you from getting a particular medical condition. Prevention is carried out so you boost your immune system. So when you come across, let's say, a parasite or a virus or a bacteria, your body is able to fight those organisms. A typical example is when pregnant women are given anti-malarial drugs to prevent them from getting malaria when they are pregnant. Also, we talk of medicines used in management of conditions. We manage chronic medical conditions, and typical examples are diabetes and hypertension. These are conditions that you cannot treat, but you can manage it. For instance, a high blood pressure, you can take an antihypertensive tablet so that your blood pressure can come to a level that is normal. And this prevents you from suffering from worsening conditions or worsening high blood pressure conditions like cardiac failure and stroke. So these are things that medicines are used for.
That's very important. And in fact, when you talk about prevention, they're also very important in children because we give them immunizations to protect them from certain diseases that are known to kill children or even let them become not as we want them to be. So that is very, very important. And it's also important that pregnant women are given some medication. You mentioned malaria. It is very important in our part of the world, Ghana. And because of the effects of malaria on pregnancy, which we have dealt with in our previous discussion, it is very important that pregnant women are given medications to prevent them from getting malaria. Thank you. Now, what is the difference between a prescription medicine and a non-prescription medicine?
So, a prescription medicine or a prescription drug is a drug that you cannot just walk into a pharmacy and buy. It's a drug that is written by a qualified healthcare professional for a named patient. So it's written for a specific medical condition. A typical example is amlodipine or atenolol for the treatment of high blood pressure. And it's only to be taken by the person who has been prescribed for. No other person can take such a medication.
Lydia, that is very important because sometimes people take other people's medications. So it is very important that as general public, as pregnant women, we remember that Lydia is telling us that a prescribed medicine or drug is one that is written for a named person. That is very important. So if it is not your name that is on that prescription form, it means that you don't have any business taking that medicine. Is that correct?
Yes, it's very, very essential that you don't take any medicine that is not yours.
Wow.
So when we talk of non-prescription drugs, they fall under two categories. We've got the pharmacy-only drugs and we've got the over-the-counter drugs. The pharmacy-only drugs, they are non-prescription drugs. You can go into the pharmacy and buy them, but then before you buy them, there has to be a pharmacist in the premises. So if there's any intervention that needs making, the pharmacist is there to make that intervention. Sometimes you walk into the pharmacy and you want to buy a drug that can possibly interact with a drug that you are taking. Or you can suffer side effects from a particular drug that you are buying because you suffer a medical condition that the drug can interact with. So it's very essential that when you're buying a pharmacy-only drug, there's a pharmacist there to intervene if need be. There's also over-the-counter drug. These are non-prescription drugs as well, but these are drugs that you can even buy from a supermarket. A typical example is paracetamol. You can buy paracetamol from a supermarket. These drugs, over the years, have been proven to be very safe. Safe in the sense that if you are taking it according to the manufacturer's specification, then you are sure that you won't suffer any adverse effect. The essential point I want to draw people's attention to here is that once you buy the drug, make sure that you read whatever is printed on the box. because on the box, it tells you what drug is in the tablet or the capsule or the liquid that you are buying. It tells you how many you are meant to take at a particular time and how many you are meant to take within, let's say, 24 hours. So it's very essential that even if it's not a prescription drug and you buy it from the pharmacy, you take it according to what the manufacturer has advised that you take it.
Yeah. Auntie Lydia, that is very interesting and important. But, people don't want to read. So somebody buys medication and then just decides, let me take this amount because I'm an adult. Or if I'm going to give it to a child, then let me just give the child half of what I would have taken. So from what you have said, it means that that's not what we are supposed to do. But you see, the paper that they put inside the medicine, sometimes it is too long. So which side of it should somebody read? Or what should we do when we go to buy this medicine? Because I can tell that a lot of people will not read what is written there. So how can we go around that?
Yeah, so what you need to do is, if you're not sure about anything, you need to speak to the pharmacist.
Okay.
Or any healthcare professional who is specialized in the area of drugs. Okay. It's very, very essential if you have any questions at all. The pharmacists are there in the community to help with such issues.
Okay, it is very important. And these days in Ghana, we have a lot of pharmacy shops. We have a lot of chemical shops. But one thing you said, which I think is very important for everybody to note, is that there are medicines, though you don't need a prescription, that should be purchased from a pharmacy shop. Ladies and gentlemen, this is very important because the pharmacist has been trained, as she explained to us. The chemical seller who is in the drugstore or the chemical store has also been trained, but their trainings are different. So if you have to buy a medication and you go to a pharmacy shop where they have a pharmacist, then you are sure to have other services. And we've just been told that if you get there, just ask. And the pharmacist, I'm sure, will be very happy to explain to you some of the things that need to be done and what you have to be careful of. Maybe the person will ask you, the pharmacist will ask you whether you are taking any medications, and you answer yes or no, then he or she would know what to tell you. So I believe that if you are taking any medication and you are going to buy some medication, if you are not sure, just carry the box or the medication to the pharmacy shop, so that when you are speaking to the pharmacist, he or she would understand exactly what you are saying when you show that person the box or the medicine that you are taking. I'm sure that that would be helpful.
Yeah.
Auntie Lydia, there's one other thing that you said, which I would like us to explain a little more. And that is, if you have to take a medication over 24 hours, some people will take it within 3 hours, they will take another one within 3 hours. Is that how it's supposed to be taken? You are supposed to take maybe a particular drug 3 times in a day. How should the person take it?
So if you are prescribed a drug and you're meant to take it 3 times in a day, it's very, very important that you space them equally. There's a reason behind all these.
Yeah.
You can take some in the morning, you can take some in the afternoon, you can take some in the evening. I will say if a medicine is prescribed 3 times a day, you can take them 8 hours apart. Sometimes some doctors go to the extent of writing, take one every 8 hours. And that is very, very specific. If it's done 3 times a day, then you have to consciously make sure that you are spacing them equally and taking them at the intervals that you are meant to be taking them. Something like paracetamol, for instance, you can take it up to 4 times a day.
Okay.
It means that you can take it once a day. You can take just 2 tablets once a day. You can take 2 tablets twice a day. You can take 2 tablets 3 times a day. You can take 2 tablets 4 times a day, which makes it up to 4 times a day. And when you are meant to take it 4 times a day, then it means that you're really, really suffering from a kind of pain that you need to constantly be taking the drug so the pain will go away, so you can have some comfort. And when you're meant to take it like that, it means you can space it 6 hours apart. 6 hours apart is really, really hard to get within the time that you are awake. It means that when you are sleeping, you need to wake up and take some of the time. So what is advised is that you take them 4 hours apart. So you are able to fit the 4 times a day within the period that you are awake.
Okay.
So it means you can take some around 6 a.m. in the morning. You can take the next dose, let's say around 10 a.m. The next dose can be taken around, let's say 4. The next dose can be taken just before you go to bed. So it's very important that you work out the times and make sure it's also suitable for you to take them at those times. Yeah.
Okay. That is very important. And I believe that if you go to get the medicine, you can also do that scheduling with the person who is selling it, so that if they're not sure, they can write it at the back of the envelope or even somewhere for you. So when you go home, you are sure. And especially when you are giving it to children, where they would depend on the adult to take that medication, please ask the pharmacist or ask whoever is giving you the medicine to tell you how you should take the medicine. You don't go home and decide that I gave it to you, now it's 2 hours, let me give it to you. Because as Auntie Lydia said, there's a reason for prescribing so many times in a day. It is very important. Now let's go for a short break. Welcome back. Before we went on the break, we were talking about how to take medicines. Now we are moving on to the pregnant woman. Lydia, why should pregnant women be careful about medications or drugs that they take?
Okay, so most drugs are not safe to take in pregnancy. Once you plan to get pregnant, or even if you realize that you are pregnant, one of the first things that you need to do is speak to a healthcare professional. It could be your doctor, it could be the midwife, it could be the pharmacist in your community. And if you're someone who is on any medication, what they will do is they will carry out a review with you. They'll look at all the medicines that you are taking. Some medicines are not good to be taken in pregnancy. What would happen is some of your medicines would be changed over to ones that are safer to take in pregnancy. And some of the doses of some of the medicines that you are taking might be reduced. And some of the medicines will be stopped altogether. It is very essential that this is done because drugs can affect pregnancy in various ways. Some drugs have an effect directly on the baby in the womb, and some drugs have an indirect effect on the baby. Some drugs actually can be transferred straight to the fetus and the fetus will just die. And some drugs actually cause the muscles of the uterus to contract. And this can be done really, really forcibly, and it can cause the fetus to squeeze and then die. Also, some drugs can work on the placenta. What happens is blood vessels that supply blood to the placenta can become constricted, which means the blood vessels become very, very narrow. And blood flow to the uterus is reduced. When this happens, supply of oxygen to the baby is reduced because oxygen is needed for growth of cells and development of cells. And when this happens, the development and growth of the baby is impaired. Also, indirectly, sometimes some mothers are on drugs, for instance, for high blood pressure. When the blood pressure is reduced, it can also have an effect on blood flow to the uterus. So it is very essential that before you take any medication when you are pregnant, you speak to a healthcare worker, you speak to your doctor, you speak to your midwife, you can speak to the pharmacist so they can advise you appropriately on what to do.
Wow. Ladies and gentlemen, if you are pregnant, you don't want to take any medication that has not been prescribed for you. There are a lot of people going around selling all sorts of medications. Some of them would say that if you take this, your child will be strong, your child will be healthy, your child will be this. But from what we have heard, I don't think that if you are pregnant, you would want to go and buy any medicine at all for yourself. First of all, we have heard that prescription medicines should have your name. So you don't also want to take the medicine that somebody took when she was pregnant. You don't want to do that. And she has told us what will happen if you take medication, because drugs can have effect on the mother, on the baby, the placenta, the growth of the baby, the mother's health, so many things can go wrong.
Yeah.
You don't want to do that. How? But still, I'm sure there are some medications that pregnant women can take, and we'll come to that. But there are 3 trimesters in pregnancy. Are there medications that should be avoided during the various trimesters? The first trimester, that's the first 3 months, second trimester, second 3 months, and the third trimester, the third 3 months of pregnancy. Should we be concerned about these trimesters and the medications we take?
Yeah, it's very essential that we take note of this. Some drugs can affect certain trimesters. There are some drugs that affect the first trimester and would not have any effect on the second trimester. The same way some drugs can affect the second trimester and would not affect the first trimester. The crucial time in pregnancy that mothers need to be careful when taking any drug is from between the 3rd week and the 11th week. This is the time that the baby is formed. Most of the organs are formed around this time. And in the second trimester, there is growth and development. If you take any drug in the first trimester that you don't have to take, or a drug that has effect on the baby, what happens is the baby becomes deformed. It means that this deformation can be carried on till you give birth to the baby. A classical example is a drug called thalidomide. This drug was developed in the early 1960s. And it was found to be very useful in the prevention of morning sickness in pregnant women. But after a few years, it was realized that babies who were born to mothers who took this drug during pregnancy were born with short limbs. That is, their hands became really, really short. And some were born even with no hands or no legs at all. It was also realized that about 40% of those babies born to those mothers died at birth. So it's very, very essential that you know what you are taking is safe for you to take, and you are taking it according to the way that has been prescribed for you to take. In the second trimester, there's other drugs that can affect the development and growth of the baby. A few examples are alcohol, smoking, cocaine, opioids. All those things are not good to be taken whilst you're pregnant. I'll say a few things about them as we go along. Sometimes even some drugs given during labor can have an effect on the child that is born. And there are some drugs that you don't even see the effect immediately. The effect is seen after the baby is born, or even whilst they are growing up. You realize that those children have learning disabilities, social disabilities, and they find it difficult to really fit into society. And these are all causes of drugs that were taken during pregnancy. Another example of a drug that can have an effect on a child as well is tetracycline. This drug is an antibiotic. It's given for acne and is used for other things as well. It can actually stain the teeth of the baby. Children are born with their teeth yellowish, and this yellowish color is a permanent discoloration. So these are things that we need to actually be cautious of. Drugs are good, but drugs are dangerous. So we need to be very, very careful what we take, especially during pregnancy.
Wow. Drugs are good, but they can also be dangerous. Let's go for a short break. Welcome back. Ladies and gentlemen, this is the Online Pregnancy School. My name is Dr. Linda Vanuatu. I've been bringing you the Online Pregnancy School for a very long time, and I hope that you are learning a lot. Today, my guest is a pharmacist. She's a prescriber. She practices in the UK. Her name is Mrs. Lydia Annan. Mrs. Annan has taken us through so many things. I'm sure you have learned a lot of things. Now, if you are a female, you are in the reproductive age, that means that you can become pregnant, and you get up in the morning and you feel unwell, please don't on your own go and start taking some medications, because she said that the first trimester, in fact, the first 3 weeks to the 11th week, when the baby is forming, the eyes are forming, this one is forming, the hand is forming, a whole lot of things are forming. If you are not careful and you take medicines that have not been prescribed for you, because you may not even know that you are pregnant, then you are going to affect the growth and development of this baby. And some of them are permanent. They cannot be changed. Once the baby is born, they cannot be changed. So if you're a pregnant woman listening to us, if you are a woman who is not yet pregnant, if you are a man who is married, please learn some of these things. Even if you are not yet married, as a man or a woman, what we are talking about is very important for you. So it is key that you go ahead, learn what we are talking about, and then use it and tell others about it. It is very, very, very important. We have to learn to share. That is why we have the Online Pregnancy School. Once again, my guest is a practicing pharmacist. She's a prescriber, and her name is Mrs. Lydia Annan. Auntie Lydia, oh, you have told us so much. I hope that people will not be frightened. Hey, can I take any medicine? I'm sure there are some medicines to be taken in pregnancy. Can you take us through some of the medications that are, or drugs that are good to be taken during pregnancy?
All right, okay. So there are some drugs that can be taken during pregnancy. My first example is folic acid. Folic acid has to be taken before you get pregnant and during the first 12 weeks of pregnancy. Folic acid is a B vitamin. It occurs in the foods that we eat, especially in green leafy vegetables like kontomire, spinach. You can find folic acid also in oranges. Folic acid is needed for the production of red blood cells. During pregnancy, the demand of folic acid goes up because there has to be carriage of oxygen through the red blood cells to the baby as well. So that is the reason why you need extra folic acid to keep you going. So it's very essential that you take folic acid in the first 12 weeks, before and in the first 12 weeks of pregnancy. One other reason why you need folic acid also is because lack of folic acid can cause neural tube defect. Yes. And a typical example of neural tube defect is spina bifida. Spina bifida is a condition whereby the spinal cord is not formed properly. So babies are born with disabilities. They are born and they can become paralyzed when they get spina bifida. So it's very essential that you take your folic acid whilst you're pregnant and before pregnancy. Another medicine that normally is taken by pregnant women, or has to be taken in a sense by pregnant women, is iron. Before you take, iron is essential because that is also needed for the production of red blood cells. Red blood cells are needed for carriage of oxygen to organs and to the baby, and oxygen helps in the growth and development of the baby. before you take iron, you have to have had a blood test done, because you might have a level that you don't need iron. But once your levels are low, then the doctor or the midwife or any prescriber at all who is taking care of you would prescribe iron for you. We can get iron in some of the foods that we take. Kontomire is a typical example. And another example of a drug that you can or you might need during pregnancy is vitamin C. Vitamin C actually helps in the development of cells, and it keeps the cells healthy. Oranges are a good source of vitamin C. So it's very essential that you try and eat the fruits, the vegetables, and all those things that are required to help your body grow and to help the baby grow. It's very essential that you take a balanced diet.
Yeah.
And we all know what a balanced diet is because we've done nutrition on this program.
Yes.
So we are aware of some of these things. Calcium is also a drug that you can take. But calcium also, I want to stress that you can't just go and buy calcium and take. It's got to be prescribed, because your calcium levels have to be determined first before you take any calcium. Once the levels are determined and your levels are fine, you don't need calcium. You just continue eating food items that contain calcium. And some are dairy products. You can get calcium from green and yellow peppers. You can get calcium from avocado pears. So once you're eating all these things, you don't have any problems. But once a test is done and your levels are low, then these are very essential elements or vitamins that you would need whilst you are pregnant. Calcium is good for the development of the teeth. A very good calcium level whilst you're pregnant.
Wow. You know, that is why I said that knowledge is good. Because once you have the knowledge, you will live well. The aim of the pregnancy school is that pregnant women should go through pregnancy successfully, have healthy babies, whilst they also stay healthy. We don't want pregnancy to be a time of anxiety and fear. Pregnancy should be a time of joy. And that's why we bring you the online pregnancy school. Let's go for a short break. Welcome back. Today, we are talking about medicine use or drug use in pregnancy. And my guest is a pharmacist by profession. She's a prescriber. She's a practicing pharmacist in the UK. Her name is Mrs. Lydia Annan. Mrs. Annan has taken us through so many things. If you're a pregnant woman and you have not been watching the online pregnancy school, you are not doing yourself any good. Please go back to my Facebook page, Dr. Linda Vanutu. Look at the YouTube channel, either Dr. Linda Vanutu or SHIC Ghana TV, and listen to the previous conversations that we have had. We've had a session on nutrition, as Auntie Lydia said, and you'll be told how much to eat. You know what? In Ghana and in other places, we find that pregnant women have a lot of anemia, which means that their blood levels are not that good. And that is why we have to do what we are doing now. Lydia has told us some of the foods that we can eat. And when you are in Ghana, a lot of them are readily available. Kontomire is available. We have also spoken about what you can do by growing your own food at home. So you can have your little garden. You don't have to have the space that I would dig. No, you can have a sack You can have a container that you are not using for anything else. Put in something, grow your own things, and then eat them. Because if you go into pregnancy with very low HB or your blood is low, other things are low, you will not have a healthy pregnancy and you will not have a healthy baby. We are going to continue with our conversation. And now, Auntie Lydia, if by accident a pregnant woman takes medication in excess, or she takes a medication and she has a reaction, what should she do?
So once you take a medication and you get a reaction, the first thing to do is stop taking the medication. And you go to the nearest healthcare person. In Ghana, the nearest person will be the community pharmacy. You just go and speak to the pharmacist, let them know about the reaction that you've had, and if possible, even carry the medication with you so they know what medication you've taken and they can actually assess and let you know what to do next. So that is what you need to do. Just stop taking the medication and go to the pharmacy and speak to the pharmacist, and they'll tell you what to do.
Okay, so it is not like they will say, let's drink some oil so that you can vomit.
No, that is not good to do.
Yes.
Yeah.
And people even do it for children. When a child unfortunately takes in something accidentally, let's give the child some oil. And in fact, in my practice as a doctor, I have seen children who have come to the hospital because they drank something, they were given oil, they forced them to vomit, and then it went the wrong way. So it now went into their lungs, and these children had very difficult time breathing. In fact, some of them even unfortunately passed on. So it is very important that when you are taking a medication and you unfortunately take it, overdose, or accidentally you take whatever you are not supposed to take, please stop it. Or if you are taking even the medication that you have been given, prescribed, people are different. Maybe I take something, it's okay for me. Another person takes it, it's not okay for that person. Don't say that because I was given this medicine at the hospital, when I take it and my face gets swollen or something happens, I will still continue taking it. Please, if it is such that you cannot go to the same prescriber who gave it to you, go to a pharmacy. If that is the closest to you, tell them that this is what happened. So please, what should I do? They will look at it. If there's anything they can do for you, they will do that for you. If they will tell you to go to the hospital, they will let you know. Then you go to the hospital. That is very, very important. It is very important. Auntie Lydia,
Yes,
you have told us a lot. Now, at the end of pregnancy, is it okay that if I have medication, I can continue taking them? In fact, when I'm giving medication, should I take all of it? Or when I feel better, I can stop?
So, like I said earlier on, medicines are prescribed to be taken at specific times for a reason. And the course of medication that is given for a reason. So there are certain medications that are given for a short period of time. Let's say an antibiotic for an infection. It can be given for 5 days, it can be given for 7 days. And it's very, very important that if you are prescribed an antibiotic for an infection, you take the full course. If it's for 5 days, you need to finish taking the 5 days. If you feel better, even on the 3rd day, you need to continue taking it till it finishes. If it's a medication for a chronic condition, let's say metformin for diabetes, it's something that you are taking continuously. So even after pregnancy, you still need to continue taking it. Yeah, so it's no wonder you can stop. But if it's a medicine for a short-term period, then you need to finish it. There's a reason why you need to finish taking your antibiotic. If you don't finish taking it, you can develop resistance to that particular antibiotic. And when you get a similar infection and that same antibiotic is prescribed for you, it won't work. And you realize that this continues and continues, and it's something that can spread in a community or in a country, resistant organisms become the organisms that are prevalent in the country or in the community. And then when some antibiotics that were known to be effective against those organisms are given, they don't work anymore. So it's very, very important that we finish taking the course of drugs that we are given.
That's a very important point. So it means that you are not just harming yourself alone, but you are harming a whole community. And we don't want to do that. It also makes the work very difficult, and you spend more money, because if this medication works, but because of your actions is no more working for you, next time they might prescribe something that is more expensive to try to see whether that will work. And then, so you are affecting yourself and you are affecting other people as well. It is not the best thing to do, please. When you are giving the medication and it is prescribed that take it so many days, please do that for your sake, for everybody's sake, so that you get well and you feel better. It is very important. Can pregnant women take herbal preparations?
Okay, so studies have been done recently to show that there has been an increase in the use of herbal preparations in pregnancy. Herbal preparations are natural products, so they are good. But just like orthodox medicine, not all herbal preparations are good for pregnancy, or they are good to be taken whilst pregnant.
Okay.
It is very, very important. I want to stress here that if before you became pregnant, you were on any herbal medicine, it's very important that just when you realize that you are pregnant, you stop taking this herbal medicine. Speak to someone who is specialized in that area, and they will be able to advise you appropriately.
Okay.
If you've not started taking, or you are not taking any herbal medicines whilst you are pregnant, then there's no need to start taking any at all. There's still a lot of studies that are going on when it comes to herbal preparation. There's lots still to be learned about herbal preparations. Okay. So as much as possible, avoid taking herbal preparations. And if there is the need to take one, speak to someone who is specialized in that area.
Okay, that is very important, because in Ghana, there are some people who have been trained to prescribe herbal medicine. And in fact, some of the hospitals have these prescribers within the hospital. So if you're a pregnant woman and this is what you would prefer, as Lydia has said, don't go on your own to the market and buy anything at all. We have people who have been trained to prescribe. Even under the Ministry of Health, there's a whole division that takes care of traditional medicine. So please, and then we also have other places like the Mampon Center for Research into Plant and Scientific Medicine. They are there. So you find that the country is doing everything possible to be able to make medications safe for people. So don't on your own just buy anything from around the corner. If you want to use herbal medicine, please, we have the structures in place. Some of the hospitals have the prescribers. If you go there and you speak to the midwife, they will direct you to them. If the hospital that you're attending doesn't have a prescriber there, I'm sure they can link you up with somebody in another hospital who will help you to take what you need to take during that pregnancy. Remember, we want pregnancy to be a time of joy and not fear or anxiety. And you, as a pregnant woman and your family, you have a role to play. And the role you have to play is that do the right thing. Go for the antenatal. Lydia mentioned about alcohol use. It is very unfortunate that some women, when they are pregnant, they think that because of the nausea, because they want to vomit, if they take a little alcohol, it will be okay for them. It is not okay for you, because your baby will be drinking the alcohol with you. And when you deliver, this baby would now show signs that now I'm not getting the alcohol. We have treated alcohol in pregnancy, but we'll come back another time to talk about what happens to the baby even after the baby is born. You don't want to do that. It is not true that when you take the alcohol, it will help you to eat better. It is not true. Please, you don't want to go through pregnancy and have a baby that you'll be sorry that you have. So alcohol is a no-no. I also know that there are some pregnant women, because of the nausea and the rest, sometimes they want to hide and smoke. We have been told that smoking is another dangerous thing to do when you are pregnant. Some young people, some elder people, they smoke even before they become pregnant. So when they are pregnant, they think that they can continue. And for those who use drugs, I have had the privilege of seeing babies that have been born to women who were on cocaine and others. And I felt really sad because it's no fault of this baby. So if you're a young woman, if you're an adult, whoever you are, if you are doing that when you are pregnant, please stay off for the sake of your baby and for your own future, because you don't want to carry a baby who cannot sit or who cannot do anything. You don't want to do that. Ladies and gentlemen, this is the Online Pregnancy School, and my name is Dr. Linda Vanutu. Today, my guest is Mrs. Lydia Annan. Mrs. Annan is a pharmacist. She practices in the UK, but she's a prescriber as well, which means that she's gone very far with the pharmacy. So from that, so that you realize that she knows what she's talking about. I am sure you have learned a lot. I hope you remember that this program is sponsored by Promise Ghana, Vanuatu International, Reverse Tap, Samsara Ventures, and Erama Clinic. If you want to ask us any question, even after the program, please send me a WhatsApp message on +233 59 242 0625 or simply 059 242 0625. We have said a lot. Our topic for today is medicine use or drug use during pregnancy. We have learned so much, so much. And I hope you have also learned a lot. Now, Auntie Lydia, we are coming to the end of our discussion. It's been so interesting. I have enjoyed it. What advice do you have for the general public and also specifically for the pregnant woman?
Okay, so my first advice is to everybody is take your medication as prescribed. I can't stress this enough. Like I said earlier, there's a reason why you've been asked to take a medicine once a day, twice a day, 3 times a day, even as many times as 5 times a day. So take it as prescribed. And this is for pregnant women. Before you became pregnant, if you were used to, let's say, taking a couple of paracetamol tablets before going to bed, just so you can wake up feeling a bit better, it's very advisable that you stop doing that.
Mm-hmm.
I would advise that pregnant women try non-medicinal means of getting rid of minor medical conditions like pain, headache, fever, cough, and colds. If you have a headache, it could be that maybe you are dehydrated or you are a bit stressed, you are tired. You can just take a little rest and see if it goes away first before you decide to take any medicine. If you get a cold, you can take warm drinks. You can even try warm soup or steam inhalation instead of going to buy an over-the-counter medicine to help get the cold away. These over-the-counter medicines, some of them contain drugs that you don't want to get into your system whilst you're pregnant. Also, wash your hands as often as possible. This goes to the general public. I know you have mentioned that it's very, very important that you wash your hands, especially in this period that we are in. Wash your hands as often as you can. You don't want to catch any infection because once you catch an infection, then you have to take a drug and you don't know whether that drug is safe to be used in pregnancy or not. So it's very, very essential that you wash your hands as often as possible. Make sure your environment is always clean. If you're home, it's very important that you clean all surfaces as often as possible, because places that have been touched, often they're likely to be contaminated with organisms, parasites, bacteria, viruses. So it's very, very important that you clean surfaces. If you're working, which we do here, we clean surfaces at least 3 times in the working period or in the day, because people are touching surfaces here and there. You're touching computers, you're touching telephones, you're touching work tops here and there. So it's very important that you constantly clean after yourself so you don't catch any infection. And make sure you are always eating a balanced diet. A balanced diet has got protein in it, it's got carbohydrates, it's got a bit of fruits and vegetables that will give you your minerals, your iron, your folic acid. You need all these things for you to go through a very smooth pregnancy. And also, don't take herbal medicine in place of your antenatal appointments. If you've got to go for an antenatal visit, make sure you are going. Don't say because I'm on this drug or I'm taking this herbal preparation, I'm fine, I'll be safe and my baby will be safe. It's very essential that your doctor see you, your midwives see you, so they can help you go through your pregnancy smoothly.
Wow, you couldn't have ended on a better note. I was going to talk about the antenatal. So it is good that you have brought it up. You know, the antenatal is for you as a pregnant woman. And we have the pregnancy school as well. We have physical pregnancy school. And it is important. We introduced the pregnancy school because we realized that there was a need for pregnant women to interact more with their health worker. We wanted to give them the opportunity to ask questions and also participate in the care that they receive. If you have not identified the pregnancy school near you, please send me a message. But I hope that having joined the online pregnancy school, you are filling in the gaps if you had any. And that's why I want you to send me the questions. If you have any questions, don't hesitate. You send me a question and we'll be happy to answer them. Depending on who the question is addressed to, I can easily get that person to answer the question, or I will answer the question myself. So please don't hesitate at all. We have done a lot. We've gone through a lot of topics, and I will encourage you to go to my Facebook page at Dr. Linda Vanutu or the YouTube. Find them. Please listen to them and share with friends. And for the husbands, we want you to participate as much as possible. The antenatal is a very important time. We have had a program on the antenatal clinic, and you will see from the program what is done for the pregnant woman when she gets to the hospital. It is a time that when you get there, you can even ask some of the questions that Lydia has spoken about today. If you have any question when you go to the antenatal, don't feel shy, don't be afraid. The midwives are there for you. And we have doctors also. We have the pharmacists as well. We have different groups of people who will help to let your pregnancy be successful. So please, don't hesitate at all. If you have any question, you can send me a WhatsApp message on 059 242 0625. 059 242 0625. And I'll be very happy to answer that question for you. Today, our topic was medicine used in pregnancy or drug used in pregnancy. And my guest is my own one. My own one, Mrs. Lydia Anand. She's a pharmacist, she's a prescriber, she's a practicing pharmacist. And from what she has said and the way she's spoken about, you see how passionate she is about helping pregnant women not to misuse medicines, no matter the type of medicine or drug, so that they will have good pregnancy outcome. Mrs. Anand, we are very grateful. You have helped us to understand a lot about medicine use in pregnancy. We are so grateful. And I'm sure that a lot of people have learned a lot of things they did not know. And from now on, pregnant women are going to be very careful when they take a medicine that they want to swallow. If it has not been prescribed, they will just put it down. If it has been prescribed, they will do it according to the prescription. And if they have any challenges, they will go back to the pharmacy or go to the hospital. We thank you so much for your time and for all that you have shared with us. Ladies and gentlemen, my name once again is Dr. Linda Vanutu. It is always a pleasure to come your way with Online Pregnancy School. My desire is that pregnancy will be a time of joy and not anxiety or fear. Remember that if you want to get in touch with us, do that through a WhatsApp message 059 2420625. 059 2420625. And for those who have sent us questions in the past, we are happy. And I know that there are some testimonies that we'll be sharing soon. Very soon, we'll share testimonies of how people have benefited from these programs that we have held. Don't be left out. See you another time. Have a great day. Auntie Lydia, thank you very much. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the Online Pregnancy School as she discusses pregnancy, delivery, and childcare.